Alright guys, welcome to my channel if you haven't been following me on YouTube. And I like to talk about plastic surgery, and this is what I do. You know, if you're an engineer, you like technology like I do, this is one of my favorite things I've been using. I've been using it for over a year now. And the device is called Renuvion. And what this is radio frequency plasma basically. This is the way the device looks like when we do this in surgery. We use the same incision we use for liposuction, so there's no extra incisions. And so this is the probe. And what it has, like a little button. This plugs into a machine that it comes separately, but this is a very straightforward setup, and it's hollow. And so I'll show you like a zoom in picture, but there's a little hole at the very tip of it, and in that tip you'll see a little filament, and that filament is where the energy source comes out, which is radio frequency energy. Through the hollow tube, the technology is plasma, and so the gas is helium, and the helium hits the filament, ignites it, and then it turns into plasma. And so what is plasma? So plasma is basically just an energy. If you have seen those toys back, maybe you had them when you're a little bit older, those crystal balls that have like the purple like lightning inside of it, and you can touch the edge of it and it kind of moves where you touch it. Well, the reason the electricity is going to your fingers when you touch it is grounding. So it's trying to find collagen, which is what we have in our soft tissue. So you can kind of touch that globe. This is the exact same concept. And so if you're able to kind of watch it happen in the soft tissue, when you put in the soft tissue, and I've already created space with liposuction already, and I did Vaser probably, then now you have all this space. It's called dead space, and what you need to do is you need to get that dead space to shrink down and collapse evenly. And that's where this energy technology works really, really well, because the gas fills up the space, right? It pushes it out. It's ignited, and then what happens is that the ignition of that lightning does the same thing like crystal ball. So it's arcing to the undersurface of the skin, the collagen. It's arcing to the collagen within the fat. It's arcing to the soft tissue on the bottom of the muscle tissue. So anything that has collagen in it is going to ground. And so that lightning bolt is just kind of grabbing everything while you're putting this probe into the soft tissue. And so that's why this is such a much better soft tissue tightening than I've used before. Like I used Body Type before, I've used Thermi before. You know, that's really just skin. Like skin only has a limited amount of collagen, and it's only at the surface. This is put in deeper, put into the intrafascial plane, which is within the planes of the fat. There's a soft tissue plane, it's called the scarpus fascia, and so it grabs that. But the energy is distributed to all surfaces of soft tissue. So you get a much better shrink wrap effect of the entire soft tissue envelope versus some of the technologies like Body Type, which is just really just the skin. This is how this works. It's, you know, the biggest thing with this is, you know, how much energy do you put into the soft tissue? You know, and that's really surgeon dependent. I would say experience dependent. The surgeons that are more affluent with it, like I am, you know, it just depends on the body surface area, how much laxity they have in that area, how much stretch marks they have, how much, you know, liposuction are performed. It's just very dependent. So it's an additional tool to help me get better contours. And so that's where it makes a big difference to find a good surgeon, hopefully board certified plastic surgeon that is very familiar with the technology, very fluent with the technology, and have experience with it. And I think you'll always get better results and safer results without, you know, risk of having burns and stuff like that. So I've never had a burn. I'm getting great results with this, especially with the 1-2 combination, 1-2 punch, as I've done in my previous video with Renuvion. Following Vaser, and Vaser, that's just another level I've been getting with my patients. So don't forget, like and subscribe. Drop me a comment down in the comment section below. Love to hear your questions and comments. Thank you for following, and stay tuned for more.